I would like to thank and welcome everyone to watching today's webinar called Government Efforts in Diversifying the Health Workforce and Providing Quality Care to the Hispanic Community. My name is Monica Guerrero Vasquez, and I will be your moderator for today. I would like to start introducing and give a brief description of the HSHPS, that is the Hispanic Serving Health Professions Schools. This organization is a member-based organization composed of schools of medicine, public health, nursing, pharmacy, and dentistry. Maybe you already are familiar with the services that they provide that include academic and career development resources to students, faculty, and other health professionals. This organization addresses the mounting public health issues of providing quality and culturally competent health care to Hispanics living in the U.S. The HSHPS vision is to achieve equitable health and well-being for our Hispanic community, and their mission is to strengthen the nation's capacity to increase the Hispanic health workforce to serve and promote the health of Hispanics. The goals of the Hispanic Serving Health Professions schools are to promote the career and leadership development of Hispanic faculty in the health professions, increase the Hispanic health professional pipeline, and develop culturally and linguistically competent health professionals through institutional partnership and collaborations. Today, the HSHPS continues its celebration of the Hispanic Heritage Month by conducting the second of its webinar series with the webinar title, as I mentioned before, Government Efforts in Diversifying the Health Workforce and Providing Quality Care to the Hispanic Community. I am delighted to present today our three outstanding speakers who will talk about their agencies and offices' efforts to diversify the health workforce, as well as give us insights on what is being done to provide quality care to the Hispanic community. So let's welcome, let me introduce the speakers for today. Mr. George Coffey. She is the Deputy Assistant Secretary of the U.S. Department of Veteran Affairs, Office of Diversity and Inclusion. I'm going to tell you a little bit about Mrs. Georgia Coffey. She was named Deputy Assistant Secretary for the Diversity and Inclusion in the Department of Veterans Affairs on September 2008. And as a Deputy Assistant Secretary, she serves as the Principal Advisor to the Secretary and Assistant Secretary for Human Resources and Administration on equal employment opportunity, workforce diversity, and workplace inclusion issues. She has over 20 years of experience, diversity and dispute resolution experience in the public and private sectors, and has led several leading-edge and diversity initiatives government-wide. Prior to joining to this position in 2008, Mrs. Coffey served as the Director of the EEO and Diversity Management and Acting Assistant Commissioner for Management for the U.S. Food and Drug Administration, where she implemented similar first-time EEO and diversity initiatives. She is a prolific public speaker in diversity and inclusion in the public sector and a contributing author to the Inside the Mind, Implementing a Successful Human Resources Strategy. Welcome, Mrs. Coffey. Our second speaker for today is Dr. Julio Dicente-Lapierre. He is a team leader at the U.S. Department of Health and Human Services Centers for Disease Control and Prevention at the Office of Minority Health and Health Equity. A little bit more about Dr. Dicente-Lapierre is that during his tenure, he has filled a variety of programmatic and administrative functions as a program consultant for several national capacity building grantees, technical consultant to the organizers of the National HIV Testing Day and the National Latino AIDS Awareness Day, programmatic assistant to the division in the development of the 2008 National Latino HIV AIDS consultation, as well as an advisor and faculty to the Institute for HIV Prevention Leadership. Currently, capacity as the Hispanic Latino liaison, he represents the branch in both the Hispanic Latino and the MSM executive committees. His expertise in HIV service delivery stems from his experience as an organizational development consultant for minority and Latino health organizations in the U.S. and Latin America, an assistant editor for POZ and Espanol, and for 8 years as the director of one of the first federally funded multiple service HIV programs targeted to Latina immigrants and MSA populations in New York City. Welcome also to Mr. Dicente Lapierre. And our third speaker today is Dr. Gloria Gonzalez. She is the Public Health Advisor for the Latino Health Policy Lead, Division of Policy, U.S. Department of Health and Human Services at the Office of Minority Health. A little bit more about Dr. Gonzalez is that she is, again, the Public Health Advisor for the Office of Minority Health at the U.S. Department of Health and Human Services in the Division of Policy and Data. Dr. Gonzalez serves as a Latino Health Policy Lead at the Office of Minority Health and is the lead on work related to community health workers and the Promotores de Salud initiative. Her portfolio also includes implementation of the HHS Action Plan to reduce racial and ethnic health disparities policy coordination across the department, and its lead effort for the HHS Health Disparities Council. Dr. Gonzalez most recently served as a social science research analyst in the Food and Nutrition Services at the U.S. Department of Agriculture, conducting research and evaluation studies of the U.S. Department of Agriculture's nutrition assistance programs. Previously, Dr. Gonzalez was the Director of Research at the American Dental Education Association in Washington, D.C., conducting data collection and analysis of dental school applicants, students, and faculty. Before coming to Washington, D.C., she taught courses on racial and ethnic disparity as a visiting assistant professor of sociology at 2 liberal arts colleges on the West Coast. Dr. Gonzalez earned her PhD and Master of Arts in Sociology from the University of California, Los Angeles, with a focus on race, ethnicity, and gender, and Latino populations. Welcome also to Dr. Gonzalez. Again, I'm delighted to be moderating this session, this webinar today. I hope you all enjoy all this expertise and the stories that they are sharing with us today. So whenever you're ready, Mrs. Coffey, you can start your presentation. Thank you.
Good afternoon, everybody. Again, I'm Georgia Coffey, and I'm very, very pleased to be here addressing this fine organization and all the audience that are tuning in. Very proud to be the Deputy Assistant Secretary for Diversity and Inclusion here at VA, Department of Veterans Affairs. We think that we at Veterans Affairs have probably the most noble mission in all of federal government, here to serve our nation's heroes, those who have put their lives on the line for our country. And I know the Hispanic community is very invested in the veteran community. As a matter of fact, we get quite a few of our Hispanic employees here at VA through the veteran population. So it's really a win-win for us. I want to take just a couple of minutes to tell you a little bit about what my office does, the Office of Diversity and Inclusion. We stood up our office in 2008 when I first joined VA and restructured it because we saw at the time that there was a need to refocus the purpose and the mission of this office to be much more inclusive to all populations and to include diversity of thought as well as race, gender, and ethnicity. So we restructured our office to the current structure, which involves 3 team divisions. The first division I'll talk about is our workforce analysis team. Our workforce analysis team does all the slicing and dicing of the VA workforce by race, gender, ethnicity, disability status, and many other characteristics, as a matter of fact. And we compare our workforce composition against the relevant and the overall civilian labor force. Now, why do we do that? Because in order to identify where we may have barriers to full equal opportunity in the VA workforce, we have to know what the benchmarks are. We have to know what the availability is. And our workforce analysis team does a tremendous job at helping us identify where those triggers might be and ultimately where barriers might exist to full equal opportunity. I'm going to talk a little bit more about some key products of this team in a moment, but let me get through the other 2 divisions as well. We also have a training and communications team. This is probably the newest function that our office has assumed. And in the last 6 years or so, we have greatly grown our training portfolio. We deliver what I'm told are some of the finest diversity and inclusion, cultural competency training programs nationwide. We have made our training programs available to other agencies as well, and it's received quite a bit of good buzz, if you will. I'm a firm believer in training. I do believe that training and education is by far the single most influential way you can help change the culture of an organization. And I will tell you openly, we at VA, not unlike many other federal agencies, need to pay attention to changing our organizational culture. Training and communications is one key way we do it. The third and final team on our staff is the outreach and retention team. And that brings us to what really we're here to talk about today, and that's outreach and retention to and of the Hispanic community. As the name implies, what the outreach and retention team does is it implements a number of strategies to do focused, targeted outreach to specific communities, especially those communities where we have less than expected representation in the VA workforce. Because obviously if we have representation that is low of a particular group, we know that we are not harnessing the talent or getting the advantage of the great talent as well as diversity of thought of that community. So we don't want to harbor any glass ceilings or walls to full inclusion of any community. One of the strategies that has proven to be really quite effective and we're very proud of is our National Diversity Internship Program, which we're here to talk about a little today. You know, for many years, federal agencies have been utilizing what you would call the special emphasis internship programs or non-traditional internship programs to get students of various diverse communities into our workforces. And that's been a good thing for very many years. What we noticed a couple years ago, though, from a business perspective, is that we were not confident that the way we, as well as probably other federal agencies, were using internship programs, we weren't 100% confident that they were fully compliant with all the federal acquisition and procurement regulations. And of course, we have a duty to make sure that we're spending taxpayers' money in a financially and fiscally prudent way. So we did a little research, and thanks to a manager on our team who's now gone on to bigger and better things, but she developed the idea for what is easily called sort of a blanket purchase agreement, but it's really an IDIQ. It's an indefinite delivery, indefinite quantity contracting vehicle. It allows for the Office of Diversity and Inclusion, to centrally fund internships to diverse organizations, including this organization, and give basically our organizations in VA an opportunity to secure diverse interns from these diverse Hispanic serving institutions as well as HBCUs and other diverse institutions, secure interns from these organizations at no cost to the host organization, at no cost to them. We will absorb the cost through a centrally funded vehicle. And then we can lawfully, equitably, fairly distribute those internship opportunities among all these organizations. And we call this the National Diversity Internship Program. And we have been, I think, very successful in fact, increasing opportunities to organizations like HSHPS as well as others to make sure that we are reaching out to those communities that historically have not been well represented in VA. I will openly tell you that while we're making great enhancements and improvement to our Hispanic outreach, we're still less than we still have less than expected representation of the Hispanic communities. So NDIP is one way where we can bring in hundreds of interns from a variety of institutions around the country to get exposure to VA employment and the experience of being interns. So we're very proud of that program. Let me mention just a couple of other programs that we've done too that I think have been sort of groundbreaking. First of all, I was mentioning some of the strategies that our workforce analysis team has done that I think has been truly groundbreaking and I know has gained a lot of attraction from other federal agencies. Is we developed two indices, two metrics, if you will, that efficiently and in a very user-friendly way can show an organization what their overall diversity looks like, what their aggregate workforce diversity looks like in comparison with those benchmarks that I was talking about earlier, namely the civilian labor force. We have developed a diversity index and an inclusion index. Now, each of these two indices represents a number on the scale of 1 to 100 that at a glance will show the organization and perhaps most importantly its leadership that doesn't have a lot of time to go through 28 tables or 42 tables that are in the MD 715 report. And for my government colleagues, you'll know that's the big EEO report that we have to submit every year to the EEOC that shows the composition of our workforce by race, gender, ethnicity. But the problem is there was no one quick snapshot we could show that shows our leadership. How are we doing with respect to overall workforce diversity? Well, our diversity index that was developed by our workforce analysis team does a great job at doing that. So I can tell you on a scale of 1 to 100, we're at about 87% is the aggregate workforce diversity in comparison with the benchmark. I would call it B+, wouldn't you, in terms of overall diversity? And we know that we are going in the right direction because having done a trend analysis, we can tell you that over the last decade or so, we have increased significantly. I think about 12% over the last 6 years alone in terms of our diversity index. Same with Hispanic representation. We are still not where we should be. We should be at 100% parity with the civilian labor force. We're not. More importantly, with the relevant civilian labor force, which are Hispanics in those occupations that we hire from in VA, primarily healthcare occupations. We're not where we should be. Right now, we're at about 6.7% overall Hispanic representation in the VA workforce. I think for Hispanics is about 8.1%, so we've got some work cut out for us. But what happens is when we have interesting metrics like our diversity index, which can be further drilled down to showing you what the Hispanic index is, now we can get a good look at where we are, how far do we need to go, and where do we target our opportunities. With that, I'll bring you to the next strategy that our workforce analysis team came up with, the applicant flow project. Now, many of you organizations who are listening in, federal agencies, may or may not be aware that the U.S. Office of Personnel Management has focused on this area of applicant flow. Because what we want to know is not just how well we're doing, what the final outcome is of Hispanics in the VA workforce. We also want to know how are we doing with our outreach efforts. Like, for example, NDIP is one of our outreach strategies. Is that a difference in terms of bringing Hispanics into our workforce? One of the interesting things that our applicant flow analysis has shown us is that, in fact, VA, and I believe government-wide, but I'm going to invite a colleague of mine into the camera in a moment, so I'm giving him fair warning. I think our applicant flow shows that VA is, in fact, doing a pretty good job of reaching out to the Hispanic community, because we're finding that they are, in fact, applying at higher rates than they are available in the civilian labor force. Now, I'm going to see if this is going to work. This is Thomas Middleton. Can you see Thomas? I think you can, because I can see him in the little corner. Thomas.
Hello, Thomas.
Thank you. Thomas is a brilliant millennial. I always embarrass him by saying that, but he's really one of our more talented analysts on staff. And he can talk a little bit about the importance of this applicant flow project because he's leading it for VA. So, Thomas, say just a few words about what we have found with regard to Hispanic participation.
Through the last year and a half in partnership with OPM, we have had the capacity to do deep dive analysis into the applicant flow data, and we've determined that our outreach is indeed very well to the Hispanic community, as Georgia said, but we also found that the selection rate is also higher than selections of Hispanic for VA jobs is also higher than before. So for the first year and a half of working with data, we have seen great things from it, and we hope to continue to find out additional insights as time goes on.
Thank you, Thomas. And that was pretty good. He didn't know he was going to speak, and I think he did a brilliant job. The reason we're so interested in applicant flow, and it might sound like, gosh, Georgia, you're talking, that's such nerd stuff, right? It's just numbers, right? And I'm not understand the value of data because I know for years we, as well as many other federal agencies, were spending many, hundreds of thousands of dollars invested in areas where the data now were telling us maybe we ought to shift the emphasis, our investment, away from the initial applicant outreach to more of the in-reach. And what I mean by in-reach is this. As Thomas just explained, we are actually doing quite well with making sure that diverse communities, including Hispanics, are aware of VA's employment opportunities, are applying, and in fact are making it through the system in fairly good numbers. Now, despite the fact that our selection rate of Hispanics is above the availability, I will say there is a drop-off. What I mean by that is, I would love to say we're seeing the same percentage that are applying actually getting jobs at the end. Now, I know that's a bit unrealistic, but what the data are telling us through this applicant flow project is, let's focus our energies, our creative solutions, and yes, our dollar investments. Need exists, and the need is internally in VA, we need to educate our managers as to the importance of maintaining a diverse workforce, and that speaks to training, and that speaks to communications. And also we need to train them to make sure they are not unwittingly harboring barriers in the selection process. Because if there are cultural barriers in our selection process, in our interviewing techniques, in the questions that we ask, in the questions, the competencies that we look for, if there are unintended barriers in those processes, we're going to see a drop-off of diversity, and we're going to not make headway where we need to make headway, like, for example, with Hispanics. So I think the data are very important, and the applicant flow analysis is one tool that we use to help direct our resources. I'm sort of reaching the end of my time now, but I just wanted to highlight a couple of those couple of, oh, I apologize, you're hearing my noise outside my window, so it's a good time for me to sign off, but I wanted just to bring to your attention the NDIP program, a centrally funded IDIQ, which fairly equitably and in a very compliant way increases diverse internships in the VA, and then the applicant flow project, which tells us where are those potential barriers in our recruitment and selection process, which in turn helps us drive where we can focus our solutions and our investments. With that, I'll stop, and if there's questions, I'm happy to take them, but otherwise I'll turn it back to you.
Sure. Thank you, Mrs. Coffey. We will have a questions and answer section at the end of these three presentations, but I took close notes of everything that you said. I think it's very interesting, and as from my side, I was unaware of several of the the programs that you were mentioning, and of course the data you're showing here today. I think it's very, very interesting. So without more any delay, I would like to invite Mr. Yes.
Just one last thing. I may not be able to stay on for the question and answers, but Thomas has kindly agreed to sit in my seat, and I bet he can do a better job than I would do. Those questions. I hope he'll have a chance to offer some of the other programs that we've done, like our HERO program, our SOAR program. I know he knows about those programs that, again, speak specifically to the Hispanic community. So with that, I'll say thank you, and you'll be seeing Thomas Middleton sitting in my seat.
Thank you very much. Thank you for your time, Mrs. Coffey. So I'm going to transition to our next speaker, Mr. Julio Di Saint-Lapierre. Would you please elaborate on the efforts being done by the at your organization right now, whenever you're ready?
Sure. So thank you, and again, good afternoon. My name is Julio Di Saint-Lapierre in the Office of Minority Health and Health Equity at the Centers for Disease Control and Prevention. A little bit about the office. Our office is one of the older offices of minority health within HHS. We just celebrated last year our 25th anniversary. And like Georgia Coffey just mentioned, similarly, our office will be optimally able to address the needs of health inequities and health disparities in the United States. Our mission has changed for those who may have known of our office in the past. Our current mission is to advance health equity and women's health issues across the nation through CDC's science and programs, and increase CDC's capacity to leverage its diverse workforce and engage stakeholders towards this end. And I really like this mission, not just because it's of my office, but because it really alludes to the ways in which we're moving forward to address the issue of diversity within CDC. Our office is composed of 3 major units: the Office of Women's Health, the Diversity and Inclusion Management Unit, and our Minority Health and Health Disparities Unit, where I'm located, which is composed of 2 teams, the Science Team and the Initiatives and Partnerships Team. And while we're separate units with particular foci, we all work very collaboratively across the agency and within the office. Our office is under the Office of the Director, so we work very closely with the CDC Director, Dr. Frieden, as well as the units within that office. And we also work very collaboratively across each of the centers throughout the agency. Some centers of whom also have an Office of Minority Health, for example, in the National Center for HIV, Viral Hepatitis, STD, and TB Prevention. And we work collaboratively with those offices at the center level, as well as with ROD, in order to look at how the agency as a whole is addressing issues of diversity, is addressing issues of minority health and health equity. And the way we do that is we, each of the units focuses on either programs, like my unit, how programs are designed, who they target, where they're located, how these programs address health equity issues, and particularly the issues of minority populations, but also of other demographic issues, for example, how programs are designed to address the needs of the LGBT population, people with disabilities, people with low socioeconomic status. The science team looks at issues of where is the state of the science on health disparities, health inequities, and health equity across the agency, and how can we better build the science base for understanding how to address the public health needs of minority and other vulnerable populations across the country, as well as internationally. And we also also have the Diversity and Inclusion Management Unit, which looks at as also this issue of both collecting data on our employees, training senior leaders and general staff within the agency, socializing the agency in terms of its culture around the needs of minorities and other vulnerable populations, and how those issues are relevant to public health. This week we just finished a 5-week period of doing special emphasis seminars on Hispanic health as part of Hispanic Heritage Month, and it was primarily for staff within the agency, and to do so in a way that would invite staff from across the different centers, be that HIV, be that diabetes, be that developmental disabilities, environmental exposure, so that we could all be in the same environment and at the same time discuss issues that are pertinent to Hispanic populations. So these activities are just examples of how we're trying to both elevate the level of awareness of how Hispanic health is impacted by and needs to be addressed by public health service delivery, as well as science and the way in which we put out programs across the country through our state health departments and clinics, but also how we design our programs and how we need to think about, for example, one of our big initiatives this past 2 years has been looking at the issue of language access. Now, not unique to the Hispanic community, we do know that a significant proportion of the Hispanic population speaks English as a second language or may not speak English well. And so we are developing a mechanism and a methodology to both monitor and to improve our capacity to put out funding and to support programs that address the language access issues for the American public that doesn't speak English as a first language. So that's one example of something that cuts across all centers of the agency. We do that at a policy level, and we also provide technical assistance to each of the centers on how they would write their funding opportunity announcements, their grants and contracts in order to address the needs of people with language access issues. We are one of the model agencies that are used to look at how we put out information electronically. So if you go to our website, we have, for example, a Spanish mirror to our English website that makes material available, vital public health material available in Spanish. We are also participate in a committee that looks at vital documents and is building the inventory that we have on those documents that refer to vital information in other languages other than English, so that we can address multiple languages, not just English, for the American public. And with our international partners. For those of you who may not have heard, we are working very aggressively around Ebola, and so part of our work in the office is to ensure that the material is appropriately designed and disseminated to our minority and vulnerable populations, given that migration is very relevant to the spread of disease, in this case with Ebola. So we look at how we do that work, and we constantly are looking for opportunities to build our capacity to improve the materials, refine the communication, and refine our partnerships so that the information and the services can actually reach the intended audience. Now, to do that, we depend very heavily on our state and local partners at the health department, the hospitals and clinics that are spread out across the United States, who we fund, as well as who we partner with. But we also depend very largely on our partnerships with local and national organizations like the Hispanic Serving Health Professions Schools. And so we were very honored and happy to have been approached by HSPS, how I refer to the acronym, with an interest in signing a memorandum of understanding. And it was through that memorandum of understanding that we started to enhance our relationship with the organization. We have been a former funder of the Hispanic Serving Health Profession Schools in our 25-year history. For about 15 years, we would fund HSPS. And so we look forward to this memorandum of understanding as an enhanced way for us to collaborate with each other. We did have a meeting with the executive director last week, and we are having internal meetings very rapidly throughout the agency right now on how to stand up this memorandum of understanding so that we can do 4 key things. One is we want to make sure that Hispanic students and professionals are much more aware of our fellowship and professional development opportunities. We have currently more than 80 different fellowship programs that are open for people to apply to. And what we are hearing from our partners and from our former interns and fellows is that it's very hard to navigate our website because there's so much information on there. It tends to be information overload. So we are now starting to do a better job of streamlining the ways in which people find out the information about our fellowship programs. We're doing that work through our collaboration with our Human Resources Department. Secondly, we want to improve our fellowship promotion activities by collaborating directly with HSPS in doing joint activities where we promote our existing fellowship and professional development and even employment opportunities collaboratively. So expect to see changes and new content on the HSPS website as well as our website as we collaborate together to promote these fellowship and employment opportunities. We are also very interested in doing local events where students have an opportunity to get introduced to CDC. One of our key priorities is to introduce students to public health at an earlier age. Historically, we've focused on doctoral and postdoctoral students and medical residents in terms of our infectious disease opportunities, particularly in EIS, as well as our PHAP program, which is typically been focused on graduate students as well as doctoral students to get an experience in working in a health department or a clinic or a lab. We are interested in reaching out earlier to undergraduate and even high school students to let them know about our public health opportunities. So this is a very large priority for us at the agency and in this office, and so we look forward to working with HSPS in helping us meet the intended benefit, which is the 4th area, and that's to increase the rate and the number of Hispanics who are applying for jobs at CDC. So part of what we're looking to do with HR is to really track the extent to which Hispanic students and Hispanic professionals are applying, and really keep track of what ends up as a result of those applications. To what is the rate at which, and I'm just closing out, what is the rate at which we are actually meeting a benefit in terms of our promotion activities. So stay tuned. we will be sharing more information about those promotion activities as we move forward. Thanks.
Thank you very much, Mr. DeSantillo-Pierre. That sounds also really interesting. I'm sure that people will have questions about how to get enrolled and how to participate and create partnership with the work that you're doing, particularly in terms of outreach and working with the community. Thank you very much again. I would like to transition to Dr. Gloria Gonzalez. Again, she is the Public Health Advisor of the Latino Health Policy Lead and Division of Policy at the U.S. Department of Health and Human Resources at the Office of Minority Health. I would like to welcome Dr. Gloria Gonzalez again. Whenever you're ready, please, we would like to hear what your office is doing in terms of Hispanic and diversity. Thank you.
Thank you. Yes, thank you for having me. I wanted to first just start off a little bit talking about the work that the Office of Minority Health is doing, and also across Department of Health and Human Services. Some background on Office of Minority Health, also known as OMH, was created in 1986 as one of the most significant outcomes of the 1985 Secretary's Task Force Report on Black and Minority Health. And this is also known as a Heckler Report, which many of you may be familiar with. The office is dedicated to improving the health of racial and ethnic minority populations through the development of policies and programs, essentially that help eliminate health disparities. And the Office of Minority Health was reauthorized by the Affordable Care Act of 2010. So our mission is to improve the health and racial and ethnic minority populations through the development of these policies and programs. I want to point out three strategic priority areas. And those are to support the development and implementation of the provisions of the Affordable Care Act that address disparities and equity. And the second one is to coordinate the National Partnership for Action to end health disparities and national stakeholder strategy for achieving health equity. The third one that I will focus a little bit on is leading the implementation of the Department of Health and Human Services Action Plan to reduce racial and ethnic health disparities. You may be familiar with this. It's often referred to the Disparities Action Plan. And what this action plan is actually the first ever department-wide strategic plan committed to reducing health disparities. So it's a comprehensive federal commitment that charges all the agencies and offices with taking health equity into consideration when we develop our programs and policies, some of which has also already been discussed. Specifically, there's a goal 2 in this particular action plan. It's called Strengthen the Nation's Health and Human Services Infrastructure and Workforce. And I want to spend just a couple of times talking a bit about that. As we know how important it is to strengthen the nation's health and human services workforce, this will help us to improve care for those that are most in need. And that's the idea behind some of these investments. More than $10 million have been awarded in loan repayments by the National Health Service Corps. And this is an innovative program that's encouraging more medical students to participate, work in primary care, but then also bringing more primary care doctors to our underserved areas and communities. So thanks to the Affordable Care Act, as well as other historic investments, a number of providers are serving in the Corps, and they're really tripled since 2008. So I want to highlight just a couple of things that are ways in which working towards strengthening the nation's health and human services workforce. So as I mentioned, the National Health Service Corps, this is a particular loan repayment program that offers up to $50,000 in tax-free loan repayment for 2 years of service, and up to $140,000 for a total of 5 years of service. And the scholars that participate in this commit 2 years, commit to the service and completion of their training. So what they do is provide support for committing their time. And what's important to note here is the rate in which underserved racial and ethnic minorities are participating in these programs. So we know, according to self-reports by clinicians that are currently providing care, the numbers are for 13% are African American, 10% are Hispanic, 6% are Asian or Pacific Islander, and 2% are American Indian or Alaska Native. But in contrast, when we look at those self-reports for those participating in the National Health Service Corps, it's 18% African American, as well as 18% Hispanic, 13% Asian or Pacific Islander, and 2% American Indian or Alaskan Native. So this just shows how this particular program is increasing the numbers of racial and ethnic minorities. A second way in which I want to provide some information is the Students to Service Loan Repayment Program. What this does is it's a loan that provides repayment assistance of up to $120,000 to medical students in their last year of medical school. In return, for their commitment to provide primary health care services to eligible health professionals.
Dr. Gonzalez, I think we are having an issue with the internet. Are you still there?
Basically some shortage areas that have the greatest need in the last 3 years. I want to discuss is the Promotores de Salud and enhanced class standards that the Office of Minority has established. The Promotores de Salud initiative is a key strategy to advance health equity in Latino communities across the nation. Promotores de Salud, also known as community health workers, play an important role in reducing and also promoting health education, prevention, but reducing racial and ethnic disparities. They do this in a way, however, that's culturally and linguistically appropriate. Promotores de Salud is a big part of the blueprint for advancing health equity and supports the goals of the Affordable Care Act, but also the National Partnership for Action to End Health Disparities. And together with these, when we think about just legislative policy and programmatic actions, basically are leading to organize this, but there's also direct actions on the front lines, and these are producing very positive results for Latino populations. A bit about the class standards. They are the enhanced national class standards for culturally and linguistic appropriate services in health and healthcare. So you'll hear them referred to as class standards. And last year, this is what released by the Office of Minority Health. The original ones were in 2000, and the difference between the original and the enhanced class standards is that whereas the original ones were grounded in focusing on race, ethnicity, and language and culture, the enhanced standards are inclusive of factors ranging from race and ethnicity to language, socioeconomic status, as well as spirituality, disability status, sexual orientation, gender identity, and geography. So these standards are really geared towards a broader audience that will really more fully address the disparities, but then also highlighting the importance of the culturally and linguistically appropriate services for human services, for health and human services. While the enhanced class standards, they've been created without a specific mandate for implementation, at OMH, the Office of Minority Health, we're working towards making culturally and linguistically appropriate care for grantees, so requirement of grantees. So that way we ensure that anyone that receives funding from HHS is actively providing competent and culturally care. Specifically with regards to governance and leadership, one of the standards, one of the themes is governance, leadership, and workforce to recruit, promote, and support culturally and linguistically diverse governance, leadership, and workforce that's responsive to increasingly diverse nation, as well as to educate and train the workforce in a culturally and linguistically appropriate way. So again, emphasizing policies and practices on an ongoing basis. I want to just touch a little bit on Latinos and disparities, how Affordable Care Act and Latinos have been impacted. So we know that Latinos have the highest uninsured rates of any racial and ethnic group in the U.S. And in June, our office released a report on Men's Health for Men's Health Month. And the report is titled Characteristics of Uninsured Adult Males by Race and Ethnicity. And what this brief highlight is just the importance of, we're examining the demographic, socioeconomic, and health characteristics of Latino, African American, Asian, and white men. And what this brief revealed is that 2 out of 5 Latino men under the age of 35 were uninsured. But now, because of Historic Affordable Care Act, 8.8 million Latinos with private insurance have access to expanded preventative services with no cost sharing, and 913,000 Latino young adults between ages of 19 and 25 were able to gain coverage by staying on their parents' insurance. And moreover, 11.8 million Latinos no longer have lifetime limits on their health insurance plans. According to a recent Commonwealth Fund report, the uninsured rates fell sharply for the Latino population after the first open enrollment period. And this went from 36% in July through September 2013 to 23% in April to June in 2014. At the Office of Minority Health, we recently awarded $3 million in grant awards to 13 community-based organizations, and this was for the Partnerships to Increase Coverage in Communities initiative to help support health coverage enrollment of racial and ethnic minorities. So the way in which this, how this is important is grantees will play a critical role in connecting eligible underserved minorities to coverage that meets their needs and meets the needs of their families. There are a few grantees that I want to highlight, but the grantees do include a range of local as well as national organizations and community-based organizations. The four I'll highlight are, first, the Los Angeles-based Altamed Health Services Corporation, and what they will be doing is hiring.
Okay, so it seems there is a problem with the internet connection. Dr. Gonzalez, we are not able to hear you. So I'm going to take just a couple minutes to raise some questions.
What they'll do is help identify, assist. So two, I just want to mention, the last one I mentioned, TRUSA. The third is the National Alliance for Hispanic Health. And then finally, the National Association for Hispanic Nurses, and they'll be doing some work as well. And of course, all these programs are just going to move us a step closer to reducing health disparities, specifically in Latino communities. So thank you. That was it. I just want to thanks for the opportunity, and we're appreciate your commitments to reducing health disparities.
Oh, no, thank you very much. I was saying that we were having kind of issues with the internet connection, but I have 3 questions for each one of you. So I think you have like 30 seconds to answer. I'm going to start with Dr. Gonzalez. There is a question that says, now that the Affordable Care Act is in full effect, are there any job opportunities Latinos, Hispanics take advantage of? I will ask you to be real brief, like yes, no, and where to get information.
Right, yes. So with our grantees, there, as I started to mention, there are some opportunities out of the Affordable Care Act, and what I can do is just share some links with HSPS so they could provide some more information to be able to, so the viewers can link to those and explore that. So definitely, I'll share that information.
Wonderful, wonderful. We look forward to that. So the next question is for Mr. Julio. The question is, are there any opportunities for Hispanics regarding the fight against Ebola? And also, I would request you to be really brief.
Yes, there are 5 cities right now that are looking for support to do screening. I would check with your state or local health department if you're in one of the 5 cities. That hit the news this morning. So there are specific cities. I know Atlanta and New York are 2 of the cities. I believe Chicago is the 3rd. I would check, but I don't have enough time on this call. So, but definitely I would stay in touch with your state or local health department. They are working very closely with CDC as well as the airports. The airports are providing information about, as you know, there are daily changes to what's going on with Ebola. So I would ask everybody to just keep watching the news, keep visiting our website. We have an extensive Ebola page. and keep checking in with your health department.
Okay, wonderful. Thank you. I think you're right. This is a very new topic, so I'm sure the information will change as it comes. And the last question is for the Veterans Affairs Office to Thomas. The question for you is, what do students have to do to take advantage of the diversity programs that the VA is offering? I know this can be very extensive, so I'm going to request you to just give a brief summary of information.
Sure. Students are free to join any of our partners, those within the NDFP program, and they submit the application there, and we go through our partners to bring students on. And you can also check out information on that on our website at diversity.va.gov.
Wonderful. That was really brief. Thank you. So I'm going to respect everyone's time. I want to thank our speakers. Thank you for the hard work that you're doing, for involving other organizations. That's really nice. We will definitely check your website for more information. And also thank you, the HSHPS, for organizing this webinar. And thank you to all the listeners and all the people who are watching this webinar today. Thank you very much. Have a wonderful day and a happy Hispanic Heritage Month.
Thank you.